Good evening, everybody. I hope everyone are fine in this pandemic time. In today's class, let us try to discuss some important Gpat questions, especially from parasympathetic nervous system. In parasympathetic nervous system, we have seen muscarinic receptors, actions of acetylcholine, and nicotinic receptors, actions of nicotinic receptors, and pharmacology of atropine. So questions will be depend on parasympathetic system and acetylcholine. Let's begin this session. So the first question, let me read out the first question. Cholinergic M2 and M3 receptors produce following effects. We have M2, M3 receptors. Cholinergic M2, M3 receptors produce following effects. First one is it decreases heart rate. It increases salivary secretions. It increases heart rate. And it affects on erectile tissue. So these are the four options we have. To answer this question, let me tell you some basic points about muscarinic receptors. We know that in acetylcholine, actually acetylcholine acts on muscarinic receptors and nicotinic receptors. In muscarinic receptors, we have M1, M2, M3, M4 and M5. M4 and M5. M4 and 5 are present in central nervous system, which will mediate in cognition, which will help in memorizing, which will help in increasing the memory power. M1 receptors are present on gastric glands, which will increase the secretions of gastric hormones. M1 receptors are also present on autonomic ganglia and in central nervous system. M2 receptors are mainly present on heart. When M2 receptors are activated, it will cause all heart depression actions. Heart rate will be decreased, cardiac output will be decreased, AV conduction will be decreased, and ultimately it will decrease blood pressure. And the M3 receptors are present on smooth muscles, all smooth muscles, particularly GI tract. In the GI smooth muscles, when M3 receptors are activated, it will increase contraction of smooth muscles, and by that it will lead to diarrhea. So diarrhea is seen because peristaltic movement increases due to the contractions of smooth muscles. And M3 receptors are also present on all exocrine glands. In exocrine glands, we have lacrimal glands in the eyes, we have salivary glands in the nose, we have epithelial tissues in the nasal cavities, mucous membranes. So mucus secretions will be increased. Pancreatic hormones will be released. Sweat glands secretions will be increased. So wherever exocrine gland is present, all secretions will be increased when M3 receptor is activated. And M3 receptors are also present on endothelial cells of blood vessels. So on blood vessel endothelial cells, here we have M3 receptors, and when M3 receptors are activated, nitric oxide is released, and by that it causes vasodilation. And by that it causes reduced blood pressure. So on M2 receptors, it causes cardiac depression action. On M3 receptors, it increases exocrine secretions. So what was the question? M2 and M3 actions produces what kind of actions? So in the options we have decreased heart rate. Yes, M2 receptors are present on heart and which depresses heart. So P, first option, is correct option. Second option, increased salivary secretion. Yes, M3 receptors are present on all exocrine glands. So Q is also correct. And it increases heart rate. When M2, M3 receptors are activated, it will not increase heart rate. It is decreasing heart rate. So this option is wrong. And it affects on erectile tissue. We don't have any muscarinic receptors on erectile tissues. So there is no effect. So S is also wrong. So the correct option is P and Q. So option A is correct. I think this question is clear to you all. Acetylcholine, actions of muscarinic receptors on M1, M2, M3, M4 and M5. Clear. Now, this slide is giving some more clarity about M1, M2, M3, M4 and M5 receptors. M1 is present on central nervous system, gastric parietal cells, which causes CNS excitation, stimulation, gastric acid secretion will be increased. M1 is also present on some endocrine as well as some exocrine glands. M2 receptors mainly present on located on heart, which inhibits heart functions and causes bradycardia. M3 is present on exocrine gland. This is very important, which increases lacrimation, salivation, sweat glands, acid secretions, everything. M4, M5 is present in central nervous system, which increases memory, arousal, attention. Anyways, we have discussed all these concepts many times. I will not discuss in detail. Now we'll go to second question. This is little bit interesting question and very informative. Which of the following are adverse effects of anticholinesterase? Anticholinesterase causes what kind of adverse effects is the question. And in this we have options: abdominal cramps and diarrhea, bradycardia and hypotension, sweating, salivation, nausea, vomiting, all the above, none of the above. These are the questions, these are the options. To solve these question, let me explain you what is cholinesterase enzyme and what drugs will inhibit this enzyme and what drugs will come under anticholinesterases. See, anticholinesterases are those drugs which will inhibit an enzyme called acetylcholinesterase. Just imagine, I'll give you clarity. It is very easy to understand, nothing to confuse. Just imagine this is a parasympathetic nerve or cholinergic nerve which will release acetylcholine. It is releasing acetylcholine on postsynaptic nerve or on the muscles. Here we have muscarinic and nicotinic receptors. Just imagine. So the released acetylcholine will go and it will bind on the muscarinic and nicotinic receptors and it will mediate its actions. Just now we have seen its actions. When acetylcholine releases at the synapse, at the muscles or at the organs, here we have a very important enzyme called acetylcholinesterase, ACHE, acetylcholinesterase. This acetylcholinesterase enzyme will degrade the released acetylcholine here. The acetylcholinesterase enzyme will degrade the acetylcholine which is released. So we have some drugs which will inhibit this enzyme. When acetylcholinesterase enzyme is inhibited, the concentration of acetylcholine will increase and it will increase the actions of acetylcholine. So the drugs which will inhibit these enzymes are two types. One is reversible inhibitors and the other one is irreversible inhibitors. Reversible inhibitors are those drugs which will bind the enzyme once and after some time it will dissociate from the enzyme. Whereas irreversible inhibitors are those drugs which will bind on the enzyme but it will not dissociate from the enzyme again. So in reversible inhibitors we have carbamates, all carbamates. These carbamates are very important in the hospitals. Clinically these carbamates are having many actions. In that we have physiostigmine, neostigmine, pyridostigmine, endrophonium, rivastigmine, donazepam, galantamine, carbaryl, propoxur. All these drugs are reversible acetylcholinesterase inhibitors. We also call them as anticholinesterases. In the question they have given, which of the following are adverse effects of anticholinesterases? I'll discuss those adverse effects now. So where are we? Yes, I was discussing about anticholinesterases. In that we have reversible drugs and irreversible. In irreversible inhibitors, all organophosphate compounds are present. In that we have parathione, malathione, sarin, soman, tibone are the organophosphate gases. So these are available in gas form. Whereas parathione, malathione, phenethione, we have hundreds of examples in organophosphate compounds. We have diflose and ecothiophyte. So these are all examples of organophosphate compounds which will irreversibly block the cholinesterase enzyme, and by that they'll increase the activity of acetylcholine. Now, when acetylcholine activity is increased, just now we have seen when this enzyme is inhibited, acetylcholine activity increases. When acetylcholine activity increases, all muscarinic and nicotinic actions will be increased. What will be the actions of muscarinic and nicotinic receptors? All M1, M2, M3, M4, M5 actions will be increases, and it will show actions of all acetylcholine. So in that acetylcholine actions, what we have, see here, all acetylcholine actions will be the adverse effects of the acetylcholine. So here let me read out which of the following are adverse effects of anticholinesterases. Abdominal cramps and diarrhea. Yes, patient will have diarrhea because acetylcholine is increasing. When acetylcholine is increasing, peristaltic movement will be increased. When peristaltic movement increases, obviously patient will develop diarrhea and abdominal cramps. So first option is correct. First option is correct. And the next, it causes bradycardia and hypotension. Yes, acetylcholine is increasing with anticholinesterases. When acetylcholine increases, M2 receptors on heart and M3 receptors on endothelial blood vessels will cause bradycardia. It will decrease heart rate and it will cause hypotension. So this is also correct option. And option C, it causes sweating, salivation, nausea and vomiting. Yes, it causes sweating because all these actions are mediated by exocrine glands. Exocrine glands are present on M3 receptors are present on all exocrine glands. So when anticholinesterase is given, even exocrine hormones secretions will be increased. So option C is also correct. And option D, all the above. Option E, none of the above. So option D will be the correct. So answer for this question is option D. I think this question is clear to you all. We'll go to the next question. I'm sorry if you get some background noises. Small children are playing just behind my room. So sorry for that. Anyways, so question 3. We'll go with the question 3. Even this is also very interesting question. Anticholinesterase drugs are used in post-operative urinary retention. Which anticholinesterase drug is used in post-operative urinary retention is the question. In anticholinesterases, previously we have seen all these are anticholinesterases. Among these drug, which drug is used especially in post-operative urinary retention is the question. So to solve this question, let me tell you some points. In anticholinesterases, we have common drugs which are used in hospital are physiostigmine, neostigmine, pyridostigmine, and we have some other drugs. So physiostigmine, particularly physiostigmine, it is an alkaloid which is obtained from Physiostigma venenosum, and neostigmine, neo means new, it is a synthetic form. Physiostigmine is used in atropine poisoning. This is very important point. And neostigmine is used in myasthenia gravis. So let's go back to the question. See here. Neostigmine is used in post-operative urinary retention. Physiostigmine is used in atropine poisoning. Physiostigmine is used in atropine poisoning. We have donazepam, galantamine, and rivastigmine. These three drugs are used. These three drugs are anticholinesterase inhibitors. Cholinesterase inhibitors, which are used particularly in dementia or in Alzheimer's disease. They will ask in the upcoming examinations, anticholinesterase drug which is used in Alzheimer's disease. Any of the option is correct. Donazepam, galantamine, and rivastigmine are anticholinesterases or acetylcholinesterase inhibitors which are used in Alzheimer's disease. And pyridostigmine is used particularly in myasthenia gravis. Myasthenia gravis condition. Anticholinesterase which is used in myasthenia gravis is pyridostigmine. Anticholinesterase which is used in post-operative urinary retention is neostigmine. Anticholinesterase which is used in atropine poisoning or belladonna poisoning is physiostigmine. These four options are very important options. First, neostigmine is used in post-operative urinary retention. Physiostigmine is the drug of choice in Atropa belladonna poisoning or atropine poisoning. Donazepam, galantamine, and rivastigmine are used in Alzheimer's disease. Pyridostigmine is used in myasthenia gravis. So these four drugs are anticholinesterases which are having drug of choices in four disease conditions. Okay, so here the anticholinesterase which is used in post-operative urinary retention is neostigmine. So the correct option is neostigmine here. The answer is A. I think this third question is also clear to you all. Now we'll go with the question 4. Muscarin is obtained from which plant? So this is the question. We have Amanita muscaria. Actually, it is a mushroom. It is mushroom. We have areca nut. Areca nut plants are tall plants. They belong to tall plant families. I don't remember the family name. And we have Hyosamus niger and Atropa belladonna. Let me show you the images of these four plants. So this is Amanita species. Amanita species are the group of mushrooms which are poisonous mushrooms. These are poisonous. Amanita species mushrooms bolte. Amanita family. These mushrooms will produce a toxin or a drug called muscarin. Muscarin. So muscarin is the drug which will act on both, especially on muscarinic receptors. All acetylcholine actions which are mediated by muscarinic receptors are also mediated by muscarin. So muscarin specifically acts on muscarinic receptors. Muscarin is obtained from Amanita species of muscarin. And the second image here, the second image is areca nut. This is areca nut plant, which will produce a drug called arecolin. Arecolin is produced by areca nut plant. And the third one here, the third plant is Hyosamus niger. We obtain a drug called scopolamine. Scopolamine is obtained from this Hyosamus niger or hyoscine. We also call scopolamine as hyoscine. Scopolamine is another very important drug that we'll discuss. And finally, this plant is Atropa belladonna. From Atropa belladonna, atropine is synthesized. Atropine is synthesized. Let me repeat. From Amanita species, muscarin is synthesized. From areca nut plant, arecolin is synthesized. From Hyosamus niger, scopolamine is obtained. From Atropa belladonna, atropine is obtained. So this is scopolamine and this is atropine. So muscarin is obtained from Amanita muscaria. Simple. Amanita muscaria is the plant which synthesizes muscarin. Areca nut will synthesize arecolin. Even arecolin is also cholinergic drug. Hyosamus niger will synthesize scopolamine. And Atropa belladonna. Scopolamine is anticholinergic. And Atropa belladonna is used to from Atropa belladonna we obtain atropine. Atropine is strong anticholinergic drug. Okay, Amanita synthesizes muscarin, which is cholinergic drug. Areca nut again arecolin, which is cholinergic drug, which has both muscarinic and nicotinic actions. Hyosamus niger, which produces scopolamine, which is anticholinergic drug. Atropa belladonna, which synthesizes atropine, which is also anticholinergic. These both plants are producing cholinergic properties. These both plants are producing anticholinergic properties. You should not confuse with these two plants. I think this fourth question is also clear to you. And yes, some important points let me add for scopolamine, because scopolamine is obtained from Hyosamus niger plant, which is an anticholinergic drug. The first important point about scopolamine is it will suppress the vestibular disturbances and it is helpful in motion sickness. Motion sickness is a disease condition, is a disorder due to vestibular disturbances. Patient will develop diarrhea, patient will develop severe vomitings, and patients, especially vomitings when we are in journey or when we are traveling in the buses on the hills, we develop a condition called motion sickness. So for motion sickness, scopolamine is drug of choice. Scopolamine is available in oral form as well as in injection form as well as in transdermal patch. Transdermal patches are available, which is usually the patch is placed behind the ear over the mastoid processes. Behind the ear, when we have to apply this patch. This patch should be used at least 4 to 5 hours before the journey, and its effects will last for 72 hours. In long journey cases, if anyone is having motion sickness, scopolamine patches can be used. Scopolamine may cause sedation and dryness because scopolamine is an anticholinergic drug. It may cause dryness. With all muscarinic receptors, nicotine receptors, especially exocrine secretions will be stopped and patient will develop dryness of mouth. And sometimes sedation also can be seen with scopolamine. So in journey cases, in journey conditions, it is very good, it is very effective for motion sickness, and it will also induce sleep sedation. So in journey conditions, scopolamine patches are very effective. These are some important points about scopolamine. Next question, very important question. Atropine blocks the muscarinic actions of acetylcholine by, first option, it inhibits the synthesis of acetylcholine, or it inhibits the release from the storage, or it will block the receptors competitively, or all the above. This is a very simple question. Atropine is a strong anticholinergic drug which will block the receptors competitively. So this is the answer, simple answer. Answer C is correct because it will not inhibit any release of acetylcholine. Acetylcholine release is not inhibited by atropine. It will not inhibit the release from the storage, nor it will not. But its action is particularly, see, when acetylcholine is released, and when acetylcholine tries to goes and binds on this muscarinic receptor, atropine comes and binds on this muscarinic receptor competitively, and by that it will stop the actions of acetylcholine. So option C is the correct option for question 5. This is very easy question. I think this question is very interesting and little bit tough to answer. See, atropine derivatives which are used as pre-anesthetic agent, atropine derivatives which are used as pre-anesthetic agents, and the atropine derivative is also drug of choice in pregnancy, especially in organophosphate poisoning conditions in pregnancy. Which one is the drug of choice is the question. See, in atropine derivatives we have many atropine derivatives. Propantheline bromide is one atropine derivative. Let me check if I know. Propantheline bromide is one atropine derivative. Especially this propantheline bromide is used in cyolaria. Cyolaria is the condition where patient has excess salivation. In excess salivation condition, propantheline is used. Propantheline, when it is given, salivary secretions will be stopped. So in cyolaria condition, propantheline is drug of choice. Ipratropium bromide and tiotropium bromide are other atropine derivatives which are commonly used in asthma and COPD. Ipratropium bromide and tiotropium bromide will go and act on muscarinic receptors, and they'll cause bronchodilation, and they'll decrease the secretions of bronchioles. Bronchial secretion will be decreased, so they are drug of choice in asthma and COPD. Next, pyranozepam and telanzepam are other atropine derivatives which are particularly used in peptic ulcer conditions. In peptic ulcer, pyranozepam and telanzepam will block the M1 receptors, M3 receptors, and through that it will stop the release of acid. Through that, pyranozepam and telanzepam will be used in peptic ulcers. And the fourth option, dicyclomine flavoxate, oxybutynin, and tolterodone. These drugs are used as antispasmodics. Even these are also atropine derivatives. They are used as antispasmodics, especially in menstrual pain conditions, in muscle cramp conditions. These three drugs, especially dicyclomine, is used very commonly used antispasmodic drug. It is an atropine derivative antispasmodic drug which is used in menstrual pain. And this dicyclomine is combined with mefenamic acid, which is available as Meftal Spas. Meftal Spas करके tablet आता. In Meftal Spas we have mefenamic acid 500 mg and dicyclomine. So dicyclomine is used as antispasmodic, whereas mefenamic acid is used as NSAID, anti-inflammatory. So that combination is very effective for menstrual disorders or dysmenorrhea conditions. So these four drugs, dicyclomine, flavoxate, oxybutynin, and tolterodone, are used as antispasmodics. And glycopyrrolate. Glycopyrrolate is one drug which is used as pre-anesthetic agent, and it is the drug of choice in organophosphate poisoning in pregnancy. Actually, in organophosphate poisoning, atropine is the drug of choice. But in organophosphate poisoning, if any patient is pregnant, in that cases, glycopyrrolate is the drug of choice. So, atropine derivative which is used as pre-anesthetic agent is glycopyrrolate, and it is also a drug of choice in pregnancy. So, the correct option for sixth question is glycopyrrolate. This is the correct option. And I think the other options uses you might have understood. Okay, so that's it for today. These are 6 common questions which will be, I tried to cover most of the points from parasympathetic system. So in the next class I'll try to discuss some other questions related to sympathetic system, which is very important. Thank you. That's it for today. I'll see you in the next class.